Question: which of the following neurotransmitters is primarily involved in the pathophysiology of Parkinson's disease? A. Acetylcholine. B. Serotonin. C. Dopamine. D. GABA. Answer: C. Dopamine. Explanation: Parkinson's disease is characterized by the progressive loss of dopaminergic neurons in the substantia nigra of the brain. This leads to a deficiency of dopamine, a neurotransmitter crucial for motor control. The resulting imbalance between dopamine and other neurotransmitters, such as acetylcholine, is a key factor in the development of the motor symptoms seen in Parkinson's disease. Question: which neurological disorder is associated with the presence of Lewy bodies in brain cells and is characterized by fluctuations in cognition, visual hallucinations, and Parkinsonism? A. Alzheimer's disease. B. Multiple sclerosis. C. Huntington's disease. D. Dementia with Lewy bodies. Answer: D. Dementia with Lewy bodies. Explanation: Dementia with Lewy bodies is a neurodegenerative disorder characterized by the presence of abnormal protein aggregates called Lewy bodies in brain cells. This condition often presents with cognitive fluctuations, visual hallucinations, and motor symptoms resembling Parkinson's disease. Question: which of the following conditions is associated with a demyelinating autoimmune attack on the central nervous system and is often triggered or exacerbated by stress? A. Myasthenia gravis. B. Guillain-Barré syndrome. C. Multiple sclerosis. D. Amyotrophic lateral sclerosis, ALS. Answer: C. Multiple sclerosis. Explanation: multiple sclerosis is an autoimmune disease in which the immune system mistakenly attacks the myelin sheath of nerve fibers in the central nervous system. Stress and other environmental factors can trigger or worsen the disease. Myasthenia gravis, Guillain-Barré syndrome, and ALS are not typically associated with demyelination. Question: a patient presents with sudden, severe headache, photophobia, and neck stiffness. A lumbar puncture reveals elevated cerebrospinal fluid pressure and pleocytosis. What is the most likely diagnosis? A. Migraine. B. Subarachnoid hemorrhage. C. Cluster headache. D. Tension-type headache. Answer: B. Subarachnoid hemorrhage. Explanation: a sudden, severe headache associated with photophobia, neck stiffness, and an elevated cerebrospinal fluid pressure with pleocytosis is characteristic of a subarachnoid hemorrhage. This condition is often caused by the rupture of a cerebral aneurysm and is a medical emergency. Question: which of the following is a classic feature of Guillain-Barré syndrome, GBS? A. Progressive muscle weakness starting in the lower limbs. B. Excessive sweating and increased salivation. C. Impaired memory and cognitive decline. D. Seizures and loss of consciousness. Answer: A. Progressive muscle weakness starting in the lower limbs. Explanation: Guillain-Barré syndrome typically presents with ascending muscle weakness, beginning in the lower limbs and spreading upward. It is an autoimmune condition that affects the peripheral nervous system and is often preceded by an infection. Excessive sweating, cognitive decline, seizures, and loss of consciousness are not characteristic features of GBS. Question: a 45-year-old male presents with recurrent episodes of sudden, severe headache associated with nausea, vomiting, and photophobia. He describes the headache as the worst headache of my life. On physical examination, there is nuchal rigidity. What is the most likely diagnosis? A. Migraine. B. Tension-type headache. C. Cluster headache. D. Subarachnoid hemorrhage. Answer: D. Subarachnoid hemorrhage. Explanation: this patient's symptoms, including the sudden onset of a severe headache, nuchal rigidity, and the description of the worst headache of my life, are highly suggestive of a subarachnoid hemorrhage, often caused by the rupture of a cerebral aneurysm. Question: a 69-year-old woman presents with progressive memory loss, aphasia, and impaired judgment. Imaging shows atrophy of the temporal and parietal lobes. What is the most likely diagnosis? A. Alzheimer's disease. B. Frontotemporal dementia. C. Vascular dementia. D. Parkinson's disease. Answer: A. Alzheimer's disease. Explanation: Alzheimer's disease is a neurodegenerative disorder characterized by progressive memory loss and cognitive decline. It often involves atrophy of the temporal and parietal lobes. Frontotemporal dementia primarily affects the frontal and temporal lobes and presents with changes in behavior and language. Vascular dementia is caused by cerebrovascular disease, and Parkinson's disease primarily affects motor function. Question: A 30-year-old male experiences sudden, severe, stabbing facial pain triggered by light touch or movement, typically on one side of the face. The most likely diagnosis is A. Migraine. B. Cluster headache. C. Trigeminal neuralgia. D. Tension-type headache. Answer: C. Trigeminal neuralgia. Explanation: Trigeminal neuralgia is characterized by sudden, severe, stabbing facial pain, often triggered by light touch or movement. It typically occurs unilaterally and is commonly referred to as tic douloureux. Migraine, cluster headache, and tension-type headache have different clinical features and presentations. Question: A 55-year-old man presents with involuntary jerking movements of the upper and lower limbs, as well as facial grimacing. These movements are worsened by stress and improve with concentration. What is the most likely diagnosis? A. Huntington's disease. B. Parkinson's disease. C. Amyotrophic lateral sclerosis, ALS. D. Myasthenia gravis. Answer: A. Huntington's disease. Explanation: The described symptoms are characteristic of Huntington's disease, a hereditary neurodegenerative disorder characterized by coriform, involuntary jerking, movements, psychiatric symptoms, and cognitive decline. Symptoms worsen with stress and improve with concentration. Parkinson's disease, ALS, and myasthenia gravis have different clinical presentations. Question: A 65-year-old woman presents with episodes of muscle weakness and paralysis lasting a few minutes. These episodes are often triggered by sudden noise or strong emotions. The diagnosis is most likely A. Epilepsy. B. Multiple sclerosis. C. Myasthenia gravis. D. Hypokalemia periodic paralysis. Answer: D. Hypokalemia periodic paralysis. Explanation: Hypokalemia periodic paralysis is characterized by recurrent episodes of muscle weakness and paralysis, often triggered by factors like sudden noise or strong emotions. It is typically associated with low serum potassium levels during attacks. Epilepsy, multiple sclerosis, and myasthenia gravis have different clinical presentations and mechanisms.